all know and understand all too well, we are living in unprecedented times. More than ever before does HR have the pressing responsibility to manage the workforce through the COVID-19 crisis. Here with me today is Kathie Patterson, CHRO of Ally Financial, a financial services organization headquartered in Detroit, Michigan, one of the hardest hit areas of positive COVID-19 cases. In addition to moving 99% of the workforce to the safety of working from home, Kathie and her team have introduced significant programs to help aid employees during this most uncertain time. Kathie, thank you so much for joining me today. Can you describe some policies you've put in place in response to COVID-19?
One policy that we've put in place is in response to, I think, employees' concerns regarding paid time off. Early on, we were running into some challenges where employees were still coming to work with allergies, sinuses, colds, you name it, because it's that season, which was creating just, I think, as you probably can imagine, a level of sort of concern and regard for a lot of other employees around them when we still had employees working within the offices before we completely moved to a work from home. So one of the first things we did is really lighten up on our paid time off and gave employees that in the early onset was seen as high risk or had underlying conditions, or employees that might have had just even a common cold who would normally not want to take their PTO for just an allergy cold. We were pretty liberal with our paid time off policies. Other items that we've looked at in terms of altering our policies to meet employees where they're at is around our benefits and really looking at our co-pays and our deductibles for employees that might contract COVID, as well as employees that are working from home right now. They are not able to get out for their standard care, and so providing a level of coverage for our employees. We added 100% coverage for diagnostic testing associated with COVID-19, and we also have augmented our coverage to allow for free mental health professionals through our employee assistance program, as well as providing the 100% coverage for employees that want to go online and do the telemedicine. So those are some of the things that we took into consideration to help our employees during this time.
Great. And are there any other services that you're offering employees as you transition the workforce?
I'm really proud to say that 99% of our workforce is enabled to work from home. And, a month ago, I would never have been able to have said that. A month ago, we probably had close to about 60 to 75% of our workforce working from home. But many of our servicing locations, like our collections, our call center reps, worked within a call center. And they were not set up to work from home. And really pleased to say that, we've gotten pretty much our entire workforce working from home, with the exception of some core areas that are sort of deemed essential, such as mail service, as well as some additional support that we're doing right now as part of the SBA. So significant number of employees working from home, but as a result of those employees working from home, there's a lot of incremental costs that they're experiencing, either through child care, additional Wi-Fi, internet service. So one of the first things we did is provide our employees financial assistance during this window of time to help for those incremental costs. So all employees making $100,000 or below is eligible to receive $1,200 tax-free financial assistance to help them during this window of time. So that was one large element of financial support. The other is a lot of our employees sit on production plans and quarterly incentives. Because we have, most of our dealerships are closed, or, services are different than they were, it's affecting their production goals. So we have done our best to go back and assess for the COVID implications and give employees a level of sort of financial security for the next coming months that sit on those production plans. And that, as you probably can imagine, I think gave people a little bit more financial stability and security during a time of enormous amount of uncertainty. The other service that we offered is we have quite a few employees that are now in a position where their daycares, their schools are closed. And so we've extended our paid caregiver leave for our employees. up to 30 days of subsidy. So that was another support for our employees, in addition to the financial assistance lump sum was intended to help those employees. We also have a caregiver leave. So those employees that might have to care for a family member that contracts COVID is eligible for 2 weeks paid leave to help care for a family member during this time frame.
That's remarkable. And before I let you go today, do you have any advice for other HR leaders during this very uncertain time?
I think the best advice that I have to give is to listen. We have employee resource groups throughout the company. And, during this time frame, most are not used to working from home, having sort of that isolation. I think the majority of our employees appreciate sort of the connectivity and the collaboration that they experienced when they were at the work site. So we've started doing virtual community groups with our employee resource groups just to find out a little bit more about what their challenges are and what they're experiencing, and then also creating just a sense of community. And that has been a wonderful way for our employees to sort of talk about their experiences, understand that they're not alone, but also puts us as an HR team in a position to really understand some of the challenges and start to think about what we can do to provide support during this significant time of disruption. An example of that is we have an employee resource group for diverse abilities. And many of our members that associate with the diverse abilities are caregivers of somebody of special needs. So you can imagine the challenge that many of them are sort of experiencing now that they don't have the additional support that they once did, trying to maintain work, trying to make sure that their child is still on sort of the same development plan. And so, one, bringing together other like employees so they can share their experiences, but then we as an HR team really looking at what we can do to provide a level of support. And, sometimes that support isn't always in financial assistance. Sometimes it's about connecting them with online tutors or resources that they might not be familiar with that can help them in those particular moments. So for me, it's creating those virtual communities so employees can connect during this time of quarantine, and as an HR professional, listening to really determine where you're able to help your employee base and demonstrate a level of care and concern and support during a very challenging time.
Great, Kathie. I appreciate your feedback. Until next time, listeners, this is Debbie Bola.